Hello, everyone. Welcome to Ecolab's webinar on creating a culture of public health beyond COVID-19. Before we get started, I'd like to cover just a few logistics. If you've got any questions during the presentation, please submit them in the Q&A box on the right-hand side of the screen, and we'll answer them after the presentation concludes. Lastly, this webinar is going to be recorded and will be available on www.issashow.com. So you can watch this on demand if you're unable to stay for the entire presentation. And with that, let's get started.
Yeah, welcome to today's webinar. Thank you so much for being here. I hope you're all enjoying this sunny afternoon. We're really excited to talk to you today about creating a public health culture. We know this is critically important. Cleanliness has never been more in the forefront or more prominent. And luckily, this is right in Ecolab's wheelhouse. So Ecolab has been in the business of cleaning for almost 100 years. We just hit year 98 this year. And we're in more than 3 million customer locations across the world. So we really are here to partner with you to power those critical outcomes. So making sure you enhance your customer's experience, whether that's through spotless surfaces or well-maintained floors, creating healthy environments through comprehensive food safety and public health programs, and optimizing your operations by streamlining processes to best utilize your most important resource, your people. My name is Casey Struhler, and I'm a Principal Technical Account Specialist in our Research, Development, and Engineering function at Ecolab. I'm really excited to be here today with Amanda Bakken, a lead chemist and fellow member of our Food Safety and Public Health Leadership team. If you joined us last year, we did do a webinar last year as well, and we're really excited to be back. So today we're going to talk about the importance of disinfection beyond COVID-19. We're going to talk about how to disinfect in the most effective and efficient way possible. And then we'll end with a really thought-provoking discussion about how to make public health part of your culture moving forward. So taking all of our learnings from the past 18 months and really leveraging them to come out even stronger and better positioned for success. So without further ado, we'll dive right into the importance of disinfection beyond COVID-19. So if you live in the Northern Hemisphere, as many of us do, you're probably well aware that winter is on the horizon, ready or not. In a lot of our minds, winter becomes synonymous with illness. So I don't know about any of you, but growing up, my mom wouldn't even let me walk to the bus with wet hair for fear of catching a cold. If I was a Mythbuster, this is when I would say, myth busted. It is indeed a myth that cold temperatures themselves cause illness. But cold weather does change the way that our body responds to disease. And it also makes us behave in ways that can actually increase the risk of infection. So understanding that chain of infection is really fundamental to infection prevention and control. So an infectious agent, a microorganism with the ability to cause an infectious disease, commonly referred to as a germ, can be spread in a number of ways, a few of which we highlight here. So germs can spread from person to person via small respiratory droplets or particles that are made when someone coughs or sneezes or even just exhales. This usually happens over a relatively short distance, 3 to 6 feet, when the droplets land in the mouth or nose or even are inhaled into the lungs of a person that's nearby. Airborne transmission can happen, and this occurs when an infectious agent is carried by dust or other small particles floating around in the air. And this allows the germs to sort of remain airborne and suspended in space and does allow them to kind of move around even more than those heavier droplets. Transmission can also occur through direct contact. So this means touching someone that's been contaminated or is ill, whether they know it or not. This is one of the most common ways that germs are spread, hence why during the pandemic, a lot of folks opted to maybe bump elbows or greet each other in other ways besides shaking hands. And finally, spread can also happen indirectly through inanimate objects such as food or water, biological products like blood, or even surfaces that have been contaminated by an infected person. So cold temperatures push us indoors where we gather in spaces that may offer less than ideal ventilation and minimal personal space, all of which is a recipe for increased transmission of germs. So more than 18 months into this pandemic, you're likely all very familiar with how SARS-CoV-2 is spread, and it's not so different from how other more familiar viruses like influenza and norovirus spread. So each of these viruses can transmit very easily from person to person. We know that, especially when there's close contact through those droplets or tiny particles from an infected person. They can also be spread through direct contact. So as I mentioned, people were steering away from shaking hands or doing things where they were coming into direct contact with any potentially infected person. This could happen while you're caring for someone who you know is ill, or if you share utensils or food with someone who may not know yet that they are ill. And sometimes these germs can be transmitted via surfaces contaminated with viral particles, and that can really be the source of the spread. So we've all become a lot more aware of the ways in which germs move around in our environments and the basic infection prevention strategies that we need to deploy to maintain really solid public health. So how can we leverage this COVID-19 experience that we've all had to therefore enhance our greater public health culture? Well, I don't know about you, but I'm a scientist. So to me, data is a pretty powerful tool that we can use to highlight the impact our hyper-focus on hygiene has had over the past year. So to orient ourselves to the current landscape, let's look at where we've been in terms of viral illness and how this year might stack up to previous years. So the graph that I'm showing here represents the percent of visits for influenza-like illness over the course of a year for the last several years. The national baseline is about 2.5%. It's represented by that horizontal dotted line going across the screen. And as you can see by looking at this graph, influenza-like illness has remained below that national baseline and well below many previous flu seasons. So the circulation of viruses associated with common respiratory illnesses like the flu was certainly disrupted over the course of the pandemic. And this was due in some part to those non-pharmaceutical layered infection prevention measures that we deployed broadly. So let's zoom in a little farther and let's look at some more flu data. The maps on this slide illustrate influenza-like illness across the US during two different flu seasons, the 2019 to 2020 flu season and the 2020 to 2021 flu seasons, respectively. And I think just visually looking at these, you can tell the difference between these maps is absolutely striking. We have a lot of reds and purples going on in the left-hand graph and many more greens going on in the right-hand graph. So during that earlier flu season, the 2019 to 2020, influenza-like activity was in the high to very high range for most states, whereas last flu season, 2020 to 2021, we saw very minimal activity. And actually, last flu season, we saw historically low levels of flu. So let's think about another virus that we know is all around in our environment and can make people sick, Norovirus. The data here in the graph here shows Norovirus activity over a period of many years. It's really the suspected or confirmed Norovirus outbreaks reported by week across an entire year. And the red line at the bottom of this graph illustrates outbreaks during the 2020 to 2021 Norovirus season. We really saw that the number of outbreaks reported during that season was well below the range reported during the previous 7 years, which is represented by that thicker gray line. So while 2020 did not really provide the ideal environment for spread of flu or for noro, how are we doing so far this year? Let's take a look. So we're currently in the midst of the 2021 flu season, and norovirus season is not too far behind. We would expect peak flu activity sometime between December and February. So while the majority of the US is still in that low or minimal activity level, some states are starting to creep into that moderate classification. So this is certainly something to watch as activity appears to be outpacing 2020. And the trend with noro outbreaks is actually quite similar. So that graph on the right shows norovirus outbreaks over the 3 previous years. And we can see that 2021 is outpacing 2020 by a long shot, but we're not quite back to those 2019 levels. So when we think about historically low virus activity that we've observed during the course of the pandemic, it does become quite clear that there were some infection prevention practices and behaviors that may have contributed to keeping this virus activity and the spread low. And one of those is obviously reduced in-person interaction. So a lot of us were spending a lot more time at home. We may have been cohorting with a very small group of people just to minimize our interaction with others outside of our bubble, if you will. But there were other factors that contributed to keeping the numbers really low. And many of the measures that were put into place. So things like mask wearing, physical distancing, staying home when you're feeling sick, an increased focus on hand hygiene, which we'll talk about in more detail later, and then obviously more frequent cleaning and disinfection. So all of these contributed to keeping that virus activity and the spread low, which we saw demonstrated using all that fun data in the few previous slides. So we've taken a deep dive into some of this data, but you're probably wondering, so what does this mean for me, or why should I care? Well, illness in a facility can pose a significant disruption to not only the daily operation, but also it can impact the financials in a pretty meaningful and significant way. So I want to share an example with you from the education sector. The typical elementary school student battles 8 to 10 cold and flu cases each year, leading to roughly 5 absences. If you have little kids, you know this to be true. They are sick a lot. And student absenteeism leads to US schools losing about $11 billion annually. But this doesn't just impact students. Teachers are exposed to the same pesky pathogens as students, and their absenteeism is even more costly. It rings in around $25 billion annually. So it's pretty incredible, this economic impact of illness on an operation. So what can we do about this? Is all hope lost? Should we just give up? I'd argue that all hope is not lost. In the last 18 months have really taught us a lot and demonstrated the importance of these infection prevention measures. And we'll continue to see that moving forward. So when we boil it down, what have we learned over the last 18 months? What should we keep? What can we leave behind as we move into this next phase? I know a lot of folks have been asking this question. There's so much to do, so little time. Is there anything that we actually can leave behind? So I want to highlight some of the things that we should absolutely keep. First, we definitely need to be mindful of our impact on one another. And I think the data really showed that how significantly we can impact one another. So instituting some really simple behavior changes, things like encouraging folks to stay home when they're not feeling well, can really make a dent in the spread of these illness-causing germs, essentially breaking that chain of infection and preventing others from getting ill unnecessarily. So I know a lot of employers have looked at their policies and procedures around if an employee is sick, what does that mean? What can they do? Can they stay home and recover and not come into the office or whatever operation they work in and make others sick? Second, we really need to remain focused on hand hygiene. It's estimated that 80% of infections are actually transmitted by our hands. So proper hygiene must be implemented often and correctly. And you'd be shocked to know how many folks actually don't know how to wash their hands correctly. So quick tip, 20 seconds, soap and water. That's the best possible way to make sure that your hands are clean. It's really the single most effective way to break the chain of infection as well. So again, another momism from my childhood, when we got home, the first thing we always were told to do is go wash your hands. And that's actually really, really critical to make sure that you're not spreading germs around, you're not eating with dirty hands, or doing other activities like caring for someone else, whether they're a young child or elderly, and contaminating them with all those germs on your hands. Make sure that your hand care products, both soap and sanitizer, are accessible and that your product dispensers are full. So when we think about visible ways to show that we're really keyed into hygiene, having a full dispenser of hand soap or hand sanitizer is one of the best ways to do that. It can be really irritating to go in the restroom, use the restroom, and then go to get some hand soap and the dispenser is empty. Make sure that the products that you're using are FDA compliant and that they contribute to skin health. Hang signage throughout your operation. Remind folks really how important it is to be washing their hands. I did read a recent study that was a little disheartening. One unfortunate side effect of people being vaccinated and also these COVID restrictions sort of easing is that hand washing has actually dropped to pre-COVID levels. Again, a little disheartening. We're still living through a pandemic, and there's also many pathogens in our environment beyond SARS-CoV-2 that can make us sick. So hand hygiene should still be at the forefront. And then a final infection prevention measure that we've really embraced during the pandemic, and one that should certainly remain in the forefront, is the importance of disinfecting those high-touch surfaces and objects. So studies have shown that newly introduced viruses into an operation can actually contaminate 40 to 60% of high-touch surfaces or objects in the first 2 to 4 hours. So I don't know about you, but I was absolutely shocked when I read that statistic, and hence the really important behavior change that we've seen during the pandemic of continuing to clean and disinfect those high-touch surfaces. Your patrons are more aware now than they ever have been about germs on surfaces. And so their focus may have previously been on SARS-CoV-2, but there are other pathogens that reside on surfaces that we've chatted about here today, things like noro and the flu, that we should still be thinking about when we're disinfecting. Selecting the right disinfectant is certainly key, and we'll talk more about that in depth in the next section of the presentation. So as promised, we're going to chat a little bit about effective and efficient disinfection. So why do we need to drive efficiency when it comes to infection prevention measures like surface disinfection? Well, I'm sure this isn't news to anyone, but the labor market has, been a really, really tough challenge on top of all these other things that we're being challenged with. But almost every employer has been challenged by the current labor market. So there just isn't time to waste. Every single minute of your employee's time matters, and we're all trying to do more with less. The facility care market actually has been hit extremely hard. The number of open positions have skyrocketed, and in the last 30 days, we've seen nearly 160,000 active jobs posted in the US related to keeping workplaces, offices, and companies clean and safe. So in addition to this shortage, many veteran employees use those shutdowns to sort of expedite their retirement plans, maybe taking many years of experience and expertise with them. So unfortunately, this is happening at a time when the expectations for cleanliness really have never been higher. So as we all know, hygiene really has been pushed to the forefront, even in an increasingly vaccinated world. 95% of consumers still want to see as much or more cleaning and sanitation practices, even after the vaccine has been widely distributed. And by living through a pandemic, we've all just grown to appreciate those really basic infection prevention principles, understanding mitigation strategies necessary to, as I mentioned, break that chain of infection that's caused by germs in our environment. One such principle is environmental hygiene. But how do we achieve a heightened level of cleanliness without overutilizing that labor force? We know everyone's strapped for time, so how do we make sure we continue doing these best practices, bringing them forward through the pandemic, but not overutilize our labor force? Well, one of the ways that we can do that is to optimize the 5 factors of clean, particularly those that are more labor intensive. So time, mechanical action, and procedures. So we'll focus on ways to improve the time needed to disinfect, how selecting the right chemistry can minimize the mechanical action required, and simplify cleaning procedures, which ultimately results in a more efficient use of your labor. Something we could all use, right? So there are many tools or products that we use to achieve environmental hygiene, and they each really do have a specific job. I mentioned our ISSA webinar last year. If you attended it, this might be a little bit of a review, but I think it's important to ground folks on the differences between the different types of tools that you might use for environmental hygiene. So a cleaner is formulated specifically to help remove soils, such as food particles, dirt, or other impurities from a surface, but it doesn't actually kill any organisms. A sanitizer significantly reduces the amount of bacteria on a surface, and this is really the tool that you'd use widely across food service operations because it's a requirement of the food code. A disinfectant irreversibly inactivates infectious bacteria and viruses. Keyword here, viruses. So that would be the product type necessary to address concerns around many of the germs we talked about today: flu, noro, and SARS-CoV-2. Both sanitizers and disinfectants are regulated by the US EPA, and they're used to manage public health risks. But because they make claims to kill a pest, such as a bacteria or a virus, they do require registration with the agency. Surface disinfectants are actually subject to more rigorous EPA testing requirements, and they must clear a higher bar for efficiency, effectiveness, or efficacy, as you may have heard it called, than surface sanitizers. Okay, great. So now we know what the different tools that we can use are, the different product types, but how do we know when to choose which product? Well, the most important question to ask yourself is, what type of surface are you trying to clean? Does this surface come into contact with food? If so, you should absolutely deploy a food contact sanitizer. But the vast majority of surfaces in your operation, including those high touch surfaces that we chatted about, would require a hard surface disinfectant. This is truly meant to be that workhorse. And as we'll talk about in a few slides, it's really a one-step product. It cleans and disinfects all in one step. So this product does provide disinfection level kill performance against a wide variety of organisms, including emerging pathogens like SARS-CoV-2. So as we think about ways to optimize labor in this really, really challenging environment, a best practice would certainly be to use a multi-purpose product, like a one-step disinfectant. I sort of alluded to this on the previous slide. This product does not require a pre-cleaning step if there's no visible soil. So you can save valuable resources like time and labor by both cleaning and disinfecting in one step. By only wiping a surface once to achieve your desired outcome, you're also minimizing that mechanical action required. So remember back to the 5 factors of clean, mechanical action was one area where we can help with that labor. And by using a product that can do 2 things at one time, we can absolutely optimize the labor that we're using. Selecting a disinfectant with a broad claim set will ensure you're addressing many pathogens, many of the ones that we mentioned here and many others, all at one time. So you can select one product to do a lot of the work for you and address many, many pathogens all at once. And then when you evaluate disinfectants, contact time is a critical piece of information that relates directly to your operational efficiency. So a long contact time, having to allow a surface to remain wet for 10 minutes, let's say, is a lot less efficient than allowing your surface to remain wet for just a couple minutes. So selecting a disinfectant with a shorter contact time really can help you drive that efficiency and optimize your labor. It also frees up your staff to complete the other necessary tasks that they're focused on to keep your operation up and running smoothly. And then we'll talk about the third factor, procedures, next. So the pandemic created all sorts of new challenges for operations. You're probably thinking, yeah, you're telling me. But one of those that I want to highlight here is related to schools. So a lot of schools were forced to make the decision to cohort their students and restrict the eating to the classroom. So instead of sending everyone to the cafeteria for lunchtime, students were now eating lunch at their desks. So this really pushed surfaces like a desk, which was previously a non-food contact surface, into that food contact surface realm. So pop quiz, what product category is required for a food contact surface? Is it a sanitizer or is it a disinfectant? And if you want, you can absolutely put this into the chat. Otherwise, you can just think of the answer in your head. I'll pause for a moment and let you think. So if you said sanitizer, you're absolutely correct. A food contact surface requires a sanitizer. But what's the problem with only using a sanitizer when there is a pandemic happening that's caused by a virus? You got it. Sanitizers do not typically carry virucidal claims. So traditionally, during a viral outbreak situation, like let's say the stomach flu, as it's sometimes called, or norovirus, is going around your child's school, this is a time when the operators might decide to disinfect those food contact surfaces to mitigate any risks of the virus. But many products are too strong at disinfection levels to actually be considered safe for food contact surfaces. So the surface must then be rinsed and then sanitized using a food contact sanitizer. So we know that the teachers who are typically managing much of this extra cleaning during the pandemic had no extra time to do this clunky 3-step, 2-product process. So the needs of the industry was evolving, not only in education, but elsewhere as well. And so Ecolab saw this as an opportunity, and we launched a product that can actually both sanitize, clean and sanitize in 2 steps with 1 product. So you no longer need the rinse. And the really cool thing about the product that we launched is it is a food contact sanitizer, but it carries viral claims at food contact safe levels. So this is pretty novel, that the teachers that I mentioned were doing the cleaning could clean and then sanitize the surface and also address some of these viruses that are ever present in the environment. So their kiddos can eat at their desks. They don't have to worry about dropping food and picking it up and putting it in their mouth, but we're also addressing those viral concerns. So now we've discussed what product to select for a particular job. Let's talk a little bit about how to apply those products. The first thing to consider when you select the application method is the directions for use on the product label. This is really your guide. On the screen here, you'll see some of the more common application methods on a continuum from those that are optimized for more local application to more large-scale generalized application. So first up, we'll chat a little bit about disposable wipes. When you use this application method, it can come in 2 forms. It can either be a dry roll that you're dousing with chemistry, or it might come as a pre-saturated wipe. Using this method of application really allows for flexibility and convenience when you're cleaning. It's really perfect for those in-between cleans when you don't want to get out the spray bottle and the cloth and everything else. Next up is the trigger sprayer. These are really the most traditional method of applying a product. They work well to direct a product to a surface. They're really best suited for small to mid-sized areas, and they do require some manual effort because you have to pull that trigger. But they are really cost effective. They have a low initial investment, and so they're a great option for small to mid-sized areas. If you're thinking of a larger area, like a loading dock, for example, this is maybe when you want to deploy something like a pressurized sprayer. It does require some manual effort to pump up that sprayer and build up that pressure, but it's a great way to apply a lot of product really efficiently. And then one application method that became really, really popular during the pandemic was electrostatic spraying. And so this is, again, a really efficient way to apply a chemistry, but we do need to remember that there's specific PPE and use directions required if you are going to apply either a sanitizer or disinfectant through an electrostatic sprayer. Just make sure you're doing it in the most safe way possible. So now, without further ado, I'm going to pass it over to Amanda to drop some knowledge on the best way to make public health part of your culture. Don't forget to enter your questions in the Q&A box, and we'll address them at the end.
Thank you, Casey. All right, so before we can talk about establishing a public health culture, it's important to understand what public health even is. The CDC has a great description of it. Public health is the science of improving the health of people and their communities, often through education, strategies to prevent illness, and things like promoting healthy lifestyles. So you might be thinking, what about doctors and nurses? Isn't that kind of exactly what they do? Well, there's definitely overlap there, but the main difference is that people that work in public health are trying to prevent these problems and illnesses from occurring at all. Well, oftentimes people that work in medicine are working to fix things that have already occurred. Public health has a lot in common with food safety, which might be a term that you've heard before, but food safety specifically focuses on things like food preparation and manufacturing that can lead to things like foodborne illnesses. So for today, I'd like to focus on public health as it relates to the community and shared spaces, and then those practices that can prevent illnesses and infection from occurring. So thinking about public health as it relates to your operation might be new to you, or it might already be something that's part of your day-to-day considerations. But how does that trickle down through your organization? Your staff are a critical piece of the puzzle. What do they know about public health? Do they understand the importance of it? This can be the difference between somebody just following directions and someone who is really committed to your mission and to making a difference. All right, so let's talk about public health now as a culture. Your public health culture will include how your staff think about public health and the behaviors they routinely practice and demonstrate. It's their attitude towards public health, whether or not it's important to them, and it's going to be their willingness to openly discuss concerns about it and act on it. Your staff are going to pick up on these types of thoughts and behaviors just by being part of your organization. So if you truly create this culture of public health, those thoughts and behaviors are going to be sustained over time. And this really comes through from leadership at the top, through confidence really in the part of all the employees involved, having accountability established at all levels, and sharing and communicating knowledge and information that will continue to drive towards that united goal of building a culture. Now, if you have a cleaning program in place and policies for sick employees, which I'm sure everyone here does, you've already got some form of public health culture in place. So congratulations. But most of the time, it's going to be a pretty simplistic one that is based on policies and procedures. So what I would challenge you to do is to transition your team and organization from a traditional policy-based public health culture to a behavior-based one. And the key difference between these is what's at their core. A traditional program is going to be all about the what policy, what products and tools to use, what to clean. A traditional public health culture believes that it only takes a policy or a training to change behavior in the long term. On the other hand, a behavior-based program really puts people at the core. There are human beings executing these policies and procedures, so simply running through a checklist from A to Z isn't going to establish long-term changes in how people do their work. This approach really understands that people are complex, and to be successful, You not only need to understand the what product, what procedure. Those are important pieces, but you also have to understand the system as a whole and all of the factors, both human and environmental, that will impact performance. Behavior change is complex because people are complex. And so the more that you can understand the people at the heart of your operation, the more influential you can be at creating these sustained improvements. So how can you approach this big, hairy problem of changing behaviors and changing your culture? Well, before you start, I would ask you to remember, culture is like the foundation of a building. And it's the foundation of your organization, and that takes time to change. It's also one of the most important things to get right. So even though it's not something that is going to happen overnight, it is worth doing for the positive impact it can have on your staff and all the people that you engage with. It's sometimes easiest to think about culture change as a cyclical process. So every time you go around that cycle, you're taking steps in the direction that you want to go. So start off by assessing where you're at today. How is public health currently thought of or implemented in your organization? Then take a look at where you want to go. Where do you want to end up? Once you define that, you can design steps to get you where you want to be. The next step is one of the most important pieces of the entire process, and it's communication. Communicate the why. Studies have shown adults learn a lot differently than kids do. Adults need to know why it's important to learn something or do something before you're going to get buy-in from them. When you teach adults the why and show them the impact these changes can have on them or on their environment or their community, you're going to get much stronger commitment from your team and really create that lasting change. Next step, implementation. Lead the change. Show your team what it looks like to make these changes. Really embody the culture that you want to see in them and reinforce expectations. So this is going to be a time when it's easy to slip into old habits and old processes, but staying positive and really emphasizing those wins where you see them is going to be important. Show your team that you're ready to recognize those people that step up and embrace the new culture, and you're going to find that others will follow suit. Lastly, check your progress along the way. You set some goals for your organization in the design step. Are you meeting those goals, or are there still areas to improve? If you've got further opportunities, or maybe you're not quite where you want to be yet, you can design a plan to get there and start working your way around that cycle again. Every time you go around, you're going to see progress and positive change in the direction you want to go. All right, so let's break down that cycle into some examples, and starting with the assessment step. One way you can assess where your public health culture currently sits is by asking a series of questions and answering them really with a mindset towards improvement. There are no right or wrong answers here. These are really just to map out where you are and to see where you've got opportunity to put your focus. So questions can be, are expectations clearly defined for your staff? Are they given the training to understand how to promote public health practices? Does leadership communicate the importance of public health? And is it done in a way that actually effectively reaches your staff? Do you have public health goals and ways to measure them in place? Do you celebrate good performance against those goals? And do you have strategies to pivot when those goals aren't being met? Answering these questions in an honest, really straightforward way is going to give you a very clear picture of where you are and help outline where you want to go. Now, every organization is unique, and the gaps you identify from your assessment are going to be too. But we've got some common ones shown here. In August of 2020, the CDC conducted a survey with over 2,600 adults from the National Parent-Teacher Association. Now, these responses came from a combination of educators, school staff, and parents that come from a very broad range of career backgrounds. So while these responses came from schools, they're not just centered around schools because of all of that parent input. They can be thought of in a broader context. They found that common challenges are around hand hygiene and cleaning and disinfection. But what I find really interesting in these results is that many of these barriers can be overcome with a change in culture. Looking at monitoring and enforcing, lack of time, training, capacity, or that perception that it's just unnecessary. If your staff recognize the importance of hand washing, or that the flu and the cold and norovirus can spread from surfaces and get people sick, They're going to put focus on that in their day-to-day tasks because their work culture has shown these things to be important, and these barriers will be overcome. Now, once you've identified those areas where you want to create change, you can start communicating your why and training your staff on the impact these changes can have. Remember, this is a critical step. How are these changes going to impact their work, their team, and their community? Why does this matter to them? And remember that public health is not COVID specific. Casey touched on this already, but this is something that existed before the pandemic, and it's going to continue long after because there are more things in COVID in this world that make us sick. You can use things like training sessions, signage posted in staff areas, or things I like to call wow facts. And these are going to be things that make people see something in a whole new way. Did you know that teachers are exposed to 7 times more bacteria per square inch than doctors are? I mean, wow, right? That makes you understand the impact you can have and maybe rethink how you approach your work. So now it's time to lead the change. Let's take hand hygiene as an example. Maybe that popped up as a gap in your assessment. And so through your training and staff education, you've shown them stats around hand washing, saying just by washing your hands, you can reduce the spread of respiratory and gastrointestinal illness by 20 to 50%. Just by washing hands. That's awesome. But now you need to implement that change. So look at your building. How can you make it easier and set the expectation around hand hygiene? One way is to map it out and make sure you've got the right solutions in the right places to make it easy for people to say yes. I mean, let's be honest, people can be lazy, but if you put something right in front of their face, it's a lot easier to make the choice to do it. So hand soap should be available and well stocked in all restrooms and any place food is handled. Signage could be really helpful here, right? Remind them of why it is so important to do this. Hand sanitizer stations should really be placed in all of those transitional shared spaces, high traffic areas, really anywhere people are passing from one area to another. Front doors, elevators, stairwells. Those are places you're going to want to have hand sanitizer available so you can prevent folks from bringing germs from one place into another. Now, this is just one example of how you can implement change, but based on your goals, you can create a plan that also makes it easy and really obvious for staff to follow through on your mission and your goals. All right, the last step in the cycle is to check your progress against those goals you set for yourself in the design step. How are things going? Where do you still need to strengthen your program? So depending on what your goals are, it can be really helpful to use tools to help monitor progress, maybe comparing your results across different buildings or seeing those results improve over time. But not all tools are created equally, so it's important to choose the right one to help you measure progress against your specific goals. So as an example, let's say you've got a goal to improve cleaning performance and consistency. You could use things like ATP swabs, visual checkpoints, or something like a fluorescent marker to confirm whether a surface was cleaned properly. Well, studies have shown that using a fluorescent marker to check for clean surfaces most closely compares to the gold standard of doing a microbiology culture to see what germs are actually left there. Tools like a visual assessment for clean or ATP swabs matched that gold standard less than half the time. And what that means is selecting a tool specific for your goal, like a fluorescent marker, can be extremely useful to measure surface cleanliness and disinfection and actually move the needle in your establishment. A different approach can be to partner with a vendor to conduct independent audits of your operation. This really gives you a different set of eyes looking at your procedures to identify areas of opportunity before they become a problem and support any issues with corrective actions and training that's specific to your operation. The Ecolab Science Certified program is a great example of this, and it's one that can really help you through that entire process we've talked about around building your public health culture, from selecting the right programs, training on the right topics, monitoring progress through those independent audits, and then also giving you a way to show your commitment to clean to all of the people that work in and use the space that you are cleaning. So Casey and I just threw a lot at you to think about in the past 40 minutes or so. So I'm going to highlight just a few key things to focus on today. Be transparent. A culture of public health involves everybody in the organization from top to bottom. So be transparent about what your goals are and what the impact can be to everybody. Communicate with people. Be visible. Lead the change. Make your expectations known and show them off throughout the building. Show people what you are doing to support public health and show them how you're creating these healthy spaces. Build confidence in the people that are using that space. And last, own your commitment. Once you set those goals, own them. Follow up on them and track their progress, whether it's through internal checks or through partnership with another company. Really commit to making those incremental improvements. And if you do, you can impact things like people's confidence and feeling of safety. 95% of consumers want to see as much or more cleaning post-vaccine. That's big. You can also impact student performance. Students maintain higher grades and better graduation rates in cleaner environments. That's massive. And similar to that, improved cleanliness can help reduce staff turnover rates, right? At the end of the day, the work that you and your staff do to keep places clean goes well beyond just cleaning. So now, what are you going to do to create a lasting impact? Thank you so much for your time today. If you would like to learn more about the resources Ecolab has to offer, you can visit us at ISSA in booth 4620, or you can connect with a local representative by calling 1-800-35-CLEAN. And so now we'd like to open it up to any questions you have. Feel free to submit any questions through the chat function if there's something you would like to know more about. So we did have one question come through. Is rinsing after disinfection required? And if not, does a biofilm build up over time that can create a surface for pathogens to collect and or grow? So I think that's a great question because we did talk a little bit about times where you do need to rinse and times where you're not going to need to. And it's really based on that surface type, right? So Casey covered that saying, if you've got a non-food contact surface, those high touch point areas, think of chairs and door handles and light switches and stairwell railings, elevators, things like that, you're not going to need to rinse after disinfection. You're going to use your disinfectant. You're going to wipe or let it air dry afterwards and be good to go. Places like food contact surfaces, if you're using a disinfectant on those surfaces, you are going to need to rinse after disinfecting, simply because many of those products are not approved for use on a food contact surface. That being said, you also mentioned the potential for a biofilm to build up over time. And what I'd like to say there is biofilms and things like that are generally created from soils on surfaces, not from cleaning products. So it's really important to make sure you have cleaning steps in place. If you're using something like an electrostatic sprayer in your operation, as an example, it's important to still have those cleaning tasks in place where you actually go through and wipe surfaces down to remove soils. Those are things that are going to create those environments that harbor bacteria and viruses and help them grow and persist. Another question that came in, should I disinfect outdoor areas like playgrounds or tables? Casey, do you want to take that one?
Yeah, so this is a really great question. I know, maybe a year ago, this was a lot more prevalent. People were wanting to disinfect all areas that they were spending any time in. But really best practice is to keep those disinfectants and those sanitizers indoors. There's really not a need to be disinfecting outdoor spaces. The products are really meant to be used, like Amanda said, on those high touch objects and surfaces in our indoor environments.
Another question, do disinfectants kill newer strains and variants of SARS-CoV-2?
Yeah, you want to take that one or you want me to?
I can take that one. That's a great question because as we're all aware, this virus has definitely changed over time and there's different variants coming out that we're all keeping an eye on. And what's really important to note is EPA and their list N that they have established for disinfectant products effective against the SARS-CoV-2 virus. They have stated that disinfectants that have this claim and are on list N are effective against all variants of this virus. So great question. I love that you asked it. And yes, they are. All right. Another question. Is a disinfectant required on high-touch surfaces, or would a sanitizer be strong enough? Casey, do you want to take that one?
Yeah, this is a great question. So as I sort of alluded to during the presentation, I think we hear these two words used interchangeably a lot. People say, oh, you go somewhere and you might see a sign on the door and it says, all surfaces are sanitized every hour. Or, when you sit down to eat, it says surface has been sanitized. And so I think what we need to remember is the two words are not interchangeable when we actually look at the true definition. So high touch surfaces that are non-food contact, it's a really important distinction there, should be disinfected, not sanitized, because there aren't just bacteria on surfaces, there are also viruses and a number of other pathogens that can make you sick. So high touch surfaces should be disinfected. If it's a food contact surface, that's when you might need to start thinking about, do I need to disinfect and then rinse and follow with that food contact sanitizer? Or am I just trying to address bacteria that might cause foodborne illness? And this is truly a food contact surface, which is required by food code to be sanitized. So sanitizers only have claims typically around bacteria. Like I said, the focus is really on those pathogens that can cause foodborne illness. And then in rare cases, like one of our newest products we launched, we do include viral claims at that food contact safe level, but many sanitizers, I'll say most sanitizers, do not include viral claims. And so when you want to think about, noro protection, flu protection, even the common cold is caused by viruses, you really do want to be using a disinfectant.
All right, another question. Should I be disinfecting my floors? Excuse me, I'll repeat that. Should I be disinfecting my floors? Good question. I would say most of the time the answer is going to be no, but it's something that needs to be evaluated in your individual operation. So we spoke earlier about disinfecting high touch surfaces. Most of the time, floors are not going to be considered a high touch surface. They're not areas that people are generally going to be touching a lot with their hands, right? They're areas people definitely walk across all the time, but not areas that we would consider to be avenues to spread pathogens or viruses or bacteria, stuff like that. Places where you might want to consider whether disinfecting floors is right for you would be areas like restrooms, places where you might see, biologicals, biohazards, those types of things hitting the floor, where you have maybe much more dangerous pathogens that you would be considering, right, in a restroom area. Or if you have specific environments where you have people that actually are touching the floor a lot, maybe down on the floor, for whatever reason, I might see in different childcare or, kid establishments might be a consideration, but definitely not something we would consider as a general practice. Another question, what do you think of residual disinfection products and surface modification? Is the technology growing, and what application do you think these types of products could be used for? Ooh, that is a fun one. We have definitely seen a lot of types of residual products, residual technologies come onto the market, very driven by the pandemic. I find this area very interesting, right? And I think it can be, I think products in this space can be very useful to use. But what I would call out is making sure if you are looking at a residual solution, that it will deliver the types of outcomes that you are expecting and the types of things that you are targeting for public health. Many of the solutions we've seen come onto the market only target things like odor-causing bacteria or stain-causing fungi or mold and mildew. These things specifically state on their labels that they do not impact public health. They do not kill the types of bacteria and viruses that actually make people sick. So in essence, it would be including an extra step and an extra product in your operation that is not delivering on public health outcomes and really not moving the needle for you in terms of creating these safe and healthy spaces for the people using your establishment. So that would be my call out. I think there are solutions out there that can help with public health outcomes, but we really just pay attention to those claims and make sure they align with your public health goals. Another question, what about air disinfection? Casey, do you want to take that one?
Oh yeah, air disinfection. So we know, as we've learned more about SARS-CoV-2 over the course of 18 plus months, that there are many ways that it can be transmitted. So some ways are more prevalent than others, and we might have to do things to mitigate risks around those specific transmission pathways. So in terms of air, best practice is definitely to increase the amount of air, the circulation that's happening. But I know a lot of folks thought, when electrostatic sprayers grew in popularity, or foggers, things like that, that they could disinfect the air using the same products that are really meant for surface disinfection. So again, the label is the law. When we think about EPA regulated products, we want to use them according to those label directions and make sure that unless it explicitly says that it's meant for air treatment, we're not using it in that way, because it really could harm the people that are around in that environment. And again, it might not be delivering the outcome that you're expecting. So make sure that the products you're selecting are truly delivering that outcome, to Amanda's point. And if you're looking for something with air disinfection, make sure that the product label explicitly states that that is the purpose of the product.
I think the other call out I would make here is there really is no silver bullet here, right? So it's really that layered prevention strategy that's going to be give you the best outcome. So things like in high transmission scenarios, wearing masks, keeping further away from people when you're in a shared public space, increasing that airflow, like Casey mentioned. I haven't seen an air disinfection product so far that has given me enough confidence that if I'm standing in line at the grocery store and somebody behind me sneezes, that it's going to protect me from those droplets. So, thinking through those practical applications and making sure that whatever you're choosing is truly going to be impactful to those folks that are existing and working and shopping in those places is going to be important.
Agreed.
Right. So I think I'll do a last call for questions that those were the ones we've seen come in so far. So one other question, what can be done to protect high-touch surfaces in between disinfections, especially after an infection, cough, or touch? It's a great question. So we touched on this a little bit. There are some residual technologies on the market today that do provide some of these longer lasting antimicrobial benefits. But again, if you're going to choose a solution like that, make sure that it has a claim against something like the common cold or influenza or norovirus, something that is going to be spread from a surface and be one of these community illnesses that we're really trying to protect against. Other options are going to be having things available that that folks that are using that space, either whether they're working or shopping or going to school there, are able to use. So having canisters of wipes around, we find to be very helpful. You can set those out on a reception desk in a lobby. At the entrance to the grocery store, someone can grab them and wipe down their cart really quickly. So those are really easy ways to try to continue to reduce the level of these harmful pathogens that can be on these high touch surfaces throughout the day.
Yeah, and Amanda, I would just add there, this is a really, really important one when we think about culture. So if it's part of your culture for folks to, take a squirt of that hand sanitizer when they walk in the door, if you position that hand sanitizer right in the entrance so you can't miss it, again, a great way, just that layered infection prevention strategy. They can opt for wipes, and they may also opt for hand sanitizer. So now we have 2 levels of protection versus just one.
Perfect. All right. Well, with that question, I think we will wrap it up for today. So again, thank you so much for your time. I really appreciate all the questions everyone has sent in. And this webinar will be posted at www.issashow.com to watch again later or share with colleagues. And with that, we will let you go. Thank you, everyone.
Thank you.